It's Tuesday, April 7th, and this is Now on HNN.
Behind every one of those numbers is an individual, is a family.
The fight to flatten the curve is stretching hospitals to the breaking point. I'm Michael George with the new field hospitals being set up in hard-hit communities.
Here at home, a stricter enforcement of the stay-at-home order is expected as police pledge to crack down on violators.
These N95 masks are like gold.
Thieves steal $250,000 worth of personal protective gear that was headed to hospitals and first responders.
Britain's Prime Minister wages his own fight against COVID-19. I'm Ian Lee in London, where Boris Johnson remains in intensive care.
My thoughts are with him and his family because obviously it's a very worrying time for them.
These stories plus the 2020 Nahoku Hano Hano Awards has been postponed. Coming up on This Is Now.
Good afternoon, everyone. I'm Jonathan, your director producer here alongside Ashley. You're watching This Is Now. We want to start with a grim milestone. We've reached some new numbers in regards to the number of cases that the state is reporting from the coronavirus.
Health officials are reporting 23 new coronavirus cases today, bringing the statewide total to 410. Of the new cases, 20 are on Oahu and the rest are on Maui. Hawaii's death toll remains at 5, and so far 113 people have recovered and have been released from isolation. We spoke to Lieutenant Governor Josh Green just a few moments ago. Let's listen to what he had to say.
If we test the intimate contacts of those who are positive, we will further flatten the curve. We have this capacity because the governor has a strong order for people to stay at home. We have this window of opportunity for April, and it is a gift to us. This opportunity where people have to stay at home means that we can test the close contacts, test the intimate contacts. We will pick up a lot of positives, and we will then know that they cannot go out because there's a lot of exemptions for people to go out and work, but not if you're positive. If you're positive with COVID-19, you're not going out. You got to stay in until you're over the disease. That's why we must test intimate contacts. I'm not saying crazy testing. I'm saying test the intimate contacts of people who are COVID positive, and we will crush this disease.
That's Lieutenant Governor Josh Green speaking there to our Allison Blair. She's going to have a much more in-depth report with him coming up on our evening newscast. All right, let's move to national news now. You know, the country is now reporting nearly 400,000 cases of coronavirus, and our death toll nationwide is now over 12,000. We want to get an update from the epicenter. We got Michael George there reporting for CBS News.
There were more deaths from the coronavirus in one day in New York than any other since the outbreak started. 731 people died in the state in 24 hours.
Behind every one of those numbers is an individual, is a family, is a mother, is a father, is a sister, is a brother. So a lot of pain again today.
The death toll in New York City alone is more than the number of deaths in the 9/11 attacks, when almost 3,000 died. The number of hospitalizations went up again in New York, but the three-day average is flattening, a sign the state may be reaching a plateau.
Field hospitals are now helping relieve the strain on New York's hospitals. A new one opens today here at the Billie Jean King Tennis Center, home of the U.S. Open. It has 350 beds for non-critical coronavirus patients.
There are now at least 22 field hospitals open or about to open in 18 states, including this one going up inside Detroit's Convention Center.
You're going to have some sick people here, and definitely those that need help.
In Louisiana, more than 1,800 new cases were reported Monday, bringing the total to nearly 15,000. Of the state's 512 deaths, 70% are African Americans.
When you look at being black in America, number one, people unfortunately are more likely to be of low socioeconomic status, which makes it harder to social distance. Number two, we know that blacks are more likely to have diabetes, heart disease, lung disease.
And in Wisconsin, social distancing voting. The presidential primary is taking place in the battleground state, despite Democratic efforts to delay it.
I don't think people should be voting today. People dying.
The state's Democratic governor says Republican lawmakers are forcing people to choose between their health and their right to vote. Michael George, CBS News, New York.
Back here at home, the state unemployment office says there may not be enough physical checks to send out. While they're hoping to get cash in your hands in 21 days, it may take longer for you to get your benefits. Grace Lee did an interview with Scott Murakami on Sunrise this morning. Let's take a look at that.
Scott, I just wanted to start off. We've been getting so many calls from people asking about how they should be filing because they can't get through online. Can you give us some advice and maybe walk us through the process?
So our online filings, from what we're seeing, are working. We are still receiving, on average, about 7,000. Over Saturday and Sunday, we received just under 7,000 claims per day. There are two ways of filing online. You can go through filing through our portal, which is the traditional way that we've had received unemployment insurance claims. But the other way is through the new forms process that we put up. The difference between the two is that the forms process is running 24/7. And from what I understand from our contractors and our staff, we've seen no downtime in the forms once they got launched a couple of weeks ago. The only difference between the two is that when you file a form, you receive a lot of emails saying congratulations, or you receive a message back saying congratulations, you successfully filed your claim. What will happen is we then ingest that into the mainframe. Once it's ingested, you'll receive the confirmation email along with your confirmation number, or your claims number. That's the only difference between the two. And that is still the preferred way of filing. And that's primarily, those two methods are how we've been receiving the 206,126 claims that we've received.
All right, Scott, just to be really clear, I'm not totally clear on this process. So the second one you're talking about, the forms process, that is done online as well. And how do you do that?
Yes, it's done online, and it's at HUI Claims, that's plural, 2020hawaii.gov/initial claim. And the site is actually on our website. So if they go there and they go to filing your unemployment claim, there's a green box on the bottom that says file your initial claim. That's the box for the form. If you go in through our website, through the filing and initial claim process, you'll get to the portal. Both of those take you to the same place. It's just that the form is what runs 24/7 to ensure that everyone has access to it.
Scott, we have just crossed the beginning of the month. A lot of people need to pay their rent, their mortgage, their bills. When can they see this money, and is it faster if you use direct deposit?
It is definitely faster if you use direct deposit. The other concern that I have about it is I don't know what our stock of checks are, manual checks throughout the state, because we've shifted away from doing that. So I believe there's somewhat of a limited supply. So I would encourage everyone to just when you file, put in your direct deposit information, and we will then route the money to your bank. Right now, we're still within that. We're still hoping to make payment within the 21 days, but I believe it's going to be longer. We're doing everything we can to reduce that time. And the way we're addressing that is we're looking at the entire claims process, and there are a number of checks and balances in there. But one example of it is that when somebody files, there is a low earnings report that gets triggered. And what happens is it goes out and reaches to the employer, and then the employer comes back and says, yes, this person's unemployed. What happens with that process is we eliminated it. We're trying to eliminate the whole thing. I believe we go live. We're removing that shortly. But those types of things help us to streamline the process without jeopardizing any of the checks and balances that we have in place.
All right, that's Grace Lee with the interview from Sunrise this morning. We're going to switch gears here just a little bit. I took a exercise bike ride this weekend. You went on a run, I saw on your Instagram. And I saw a lot of people out and about for no reason at all. There was a lot of people. There's some people laying on the beach, not overwhelming, and the cops were doing their thing to push them aside. But now HPD says they're going to crack down even more. So if you have no reason to be out there, we're not talking about exercising, surfing, going to the grocery store. But if you're out beach, sunbathing, or just laying around in a park, that is not going to be acceptable. Casey Lund has more on what HPD is out and about doing.
The mayor of Honolulu City and County said in these exact words, less warnings and more citations. That's what you can expect from HPD as they really work to crack down on that stay-at-home order. Waikiki is a good example of how people are following the rules, but the mayor says a lot of people are still disobeying that mandate. Now, that statewide mandate went into effect March 25th. They've been focusing on educating the public and visitors about these new rules. As of yesterday, Honolulu police officers issued 4,660 warnings and 353 citations since it went into effect. Those who violate the order could face up to a year in jail and up to a $5,000 fine. Now, both Mayor Caldwell and Governor Ige say the vast majority of people are following the rules, but more needs to be done to flatten the curve and reduce the burden on Hawaii's healthcare system.
I encourage everyone to follow the stay-at-home orders. We are doing a better and better job each and every day coordinating with the counties to enforce the 14-day mandatory quarantine on visitors as well as residents.
The other counties in Hawaii say they'll also be ramping up enforcement. Kauai has already been stopping people at checkpoints and citing them for violating the order. Maui's Mayor Mike Victorino says his county will plan on doing that soon as well. A reminder that you can still run and exercise on the sidewalks. You can still access the ocean by going through beach parks, though you're not supposed to loiter or gather there. There is a lot less lifeguard coverage on the beaches as well, something to think about.
On Kauai, the Hawaii National Guard will be assisting Kauai police at 2 checkpoints on the island today to ensure people are following the stay-at-home and quarantine orders. Officials say this is the start of more routine checkpoints at various times. They say essential workers should consider additional travel time in anticipation of lengthy traffic delays. And state leaders say there's been a rise in domestic violence cases since the mandatory stay-at-home order went into effect 2 weeks ago. The United Nations is urging government officials to continue to prosecute abusers, set up emergency warning systems in pharmacies and grocery stores, and create safe ways for women to seek support. The Domestic Violence Action Center has added a text and chat feature to their website to help victims who are stuck at home with their abusers. A full list of resources can be found on our website at hawaiinewsnow.com.
All right, a lot of you are talking about this next story online. $250,000 in medical protection equipment was stolen from a facility here in town. Lynn Kawano broke this story yesterday online. Like I said, it's getting a lot of traction. She's got all the details for us.
We're talking about important protective gear, and the company is currently caring for COVID-19 patients. Sometime between Friday night and Saturday morning, the Wilson Care Center on Kapiolani Boulevard was burglarized. More than $250,000 worth of PPE, N95 masks, surgical gloves, and face shields were stolen. Wilson Care Center has hundreds of nurses and caregivers working with clients in their home health care operation or those at assisted living facilities. The business was also planning on sharing the extras with rescue workers.
These N95 masks are like gold now, and we have to protect these supplies so that we can save them for the first responders, because it's life and death for these individuals that are going to be taking care of these active infections. And it's so important that the N95 masks are reserved for paramedics, the firefighters, police, the hospitals. We really have to make sure that they have what they need.
Wilson Care Center says they have enough for their staff and clients right now and have ordered more to be stored in a different location. Honolulu police are investigating. No arrests have been made, but if you have any information that can help with the case, or if you see someone trying to sell PPE, call Crime Stoppers at 955-8300. I'm Lynn Kawano, Hawaii News Now.
Now to an update on a story we've been following here on This Is Now. CNN is reporting that acting Navy Secretary Thomas Modly resigned today, a day after audio leaked of him calling the ousted commander of the USS Theodore Roosevelt, quote, stupid, in an address to the ship's crew. Modly reportedly told the crew that Captain Brett Crozier was either, quote, too naive or too stupid to be in command, or that he intentionally leaked a memo to the media in which Crozier warned Navy leaders about the virus quickly spreading on the aircraft carrier and urged them to take action. Yesterday, Modly, in a statement, apologized for his comments.
All right, now let's turn to a story that a lot of people are keeping their eye on here. We're talking about Japan, and the Prime Minister there just declared a state of emergency for much of the country. We got Rami Inocencio, who's there for CBS News. He filed this report.
Life will only change here in Japan as much as its citizens will actually follow that state of emergency declaration. That's because it doesn't allow for the kind of forced lockdowns we've seen in many countries from China, India, the Philippines, France, and Italy. It does empower local governments to demand their citizens to stay home, but there still is no legal standing to really force them to stay inside. So Tokyo streets, along with several other prefectures under this declaration, could still see many people walking around, as well as many cars still on those roads. Now, under that declaration, businesses and venues can be asked to close too, like department stores, movie theaters, and sports stadiums. Of course, the more that are closed, the less reason people have to be out. Services considered essential, though, those will stay open. Now, that includes supermarkets, pharmacies, and public transport, but those could run on limited schedules. The government can also seize land to set up emergency medical facilities, and it could seize medical supplies like masks if they deem that necessary. Now, geographically, this current declaration doesn't apply to all of Japan. It does affect Tokyo and 3 surrounding prefectures. You can think of them as jurisdictions similar to U.S. states. An estimated 35 million people fall under that. That means about 1 out of 4 people in Japan are affected. And by the way, an interesting technological note about adapting to life here. It's spring graduation season, and one university used remote-controlled robots. That's right, robots that let students graduate from the safe and social distance of their homes. Those avatars were dressed in caps and gowns, and each robot had a tablet, of course, with each of the students' faces. But the anxiety is real and rising, and on Twitter, the phrase "escape from Tokyo" was trending today. The government has asked people to stay where they are to try to stop the infection from spreading, but because of the nature of that state of emergency declaration, they can only ask. Rami Inocencio, CBS News, Tokyo.
I know he's on a much lighter note in his piece for our podcast listeners. Those robots that he was describing is basically like R2-D2 with a tablet of someone FaceTiming on the tablet. So it's like they could virtually graduate. We were talking about what our local graduations were going to do. There's an idea. I don't know. It
Very
would work out
interesting.
so well.
They were taking pictures too with the robots.
Yeah, it looked a little strange, but hey, you got to be inventive in times like this. We have an update from China itself.
The lockdown that served as a model for countries battling the coronavirus around the world is set to end after 11 weeks. Chinese authorities are moving to allow residents of Wuhan to once again travel in and out of the city where the pandemic began. Just after midnight Wednesday, the city's 11 million residents will be permitted to leave without special authorization as long as a mandatory smartphone application shows they are healthy and have not been in recent contact with anyone confirmed to have the virus. Wuhan is where most of China's more than 82,000 reported cases and over 3,300 deaths took place.
All right, we want to get you over to London now. British Prime Minister Boris Johnson remains in intensive care there. He's been battling coronavirus for more than 2 weeks now. Ian Lee is in London. He filed this report.
It's the biggest headline in Britain. Prime Minister Boris Johnson in a fight for his life, battling COVID-19 in the intensive care unit at this London hospital.
Well, I know I speak on behalf of the whole country when I say our thoughts are with the Prime Minister, his fiancée and his family.
Downing Street says he is breathing without a ventilator and has not been diagnosed with pneumonia. The 55-year-old was last seen in public Thursday night, worn out but cheering Britain's healthcare workers. Days later, his life is in their hands.
Well, my thoughts are with him and his family because obviously it's a very worrying time for them and his loved ones because it's very serious, and if people go into intensive care, obviously they're at grave risk.
Johnson spoke about his condition on Twitter Friday.
Although I'm feeling better and I've done my 7 days of isolation, alas, I still have one of the symptoms, a minor symptom of I still have a temperature.
The UK doesn't have a deputy prime minister, so Johnson asked Foreign Minister Dominic Raab to fill in. He told reporters the UK leader is in very good hands, as the fate of a nation now relies on them. Ian Lee, CBS News, London.
Back in the U.S., thousands of Wisconsin voters are waiting hours in line to cast ballots, and the National Guard is staffing overcrowded polling stations. This is straining the state's ability to hold Tuesday's presidential primary election in the grip of an escalating pandemic. At the same time, many voters say they did not receive their requested absentee ballots and, unwilling to violate a stay-at-home order to vote in person, accepted their votes would not be counted. The chaos in Wisconsin underscores the lengths to which the outbreak has upended politics as Democrats seek a nominee to take on President Donald Trump this fall.
And we're seeing in this video that we're looking at is just how those poll workers are actually doing their jobs today in gloves and plastic shields and face masks, a much different sight than we've ever seen for any election in the past. So stay tuned for KHNL News at 5:30 for an update on how those polls turn out. All right, we want to turn now to some other headlines from across the nation. There's a silver lining for quarantiners in LA, and some folks are looking to get baseball back on track. Here's Elise Preston.
Major League Baseball and its players union are searching for ways to safely begin the 2020 season. League officials say they have discussed putting all 30 teams in the Phoenix area and playing in empty stadiums, but have not developed a detailed plan. They say the health of employees, players, and fans must come first. U.S. Army recruits will not be reporting to basic combat training for at least 2 weeks to help prevent the spread of COVID-19. Recruiting stations are already closed, with all new enlistees signing up online. And with so many people staying home and off the roads, the air in Los Angeles is improving by the day. A new study from IQ Air even suggests the city has the cleanest air in the world. The EPA also recently reported that LA is experiencing the longest consecutive good air days since 1980. Elise Preston, CBS News, New York.
Now, getting groceries is no longer just a simple trip to the grocery store anymore, but NBC's Vicky Nguyen shows us how some stores are switching to delivery.
This morning, many Americans are wondering how to get food and other household necessities after this alarming warning from Dr. Deborah Birx, the White House coronavirus response coordinator.
This is the moment to not be going to the grocery store, not going to the pharmacy, but doing everything you can to keep your family and your friends safe.
Birx clarifying those headline-making comments on Monday.
And what I meant was, if you can consolidate, if you can send one person, the entire family doesn't need to go out on these occasions. So, maybe once every 2 weeks, we can do a grocery store and pharmacy shop for the entire family.
And that means the way we all shop will have to change.
Grocers have been finding innovative solutions and ways to meet the growing consumer demand in online sales.
Laura Strange represents the National Grocers Association, a group of 8,000 independent stores.
What exactly are grocery stores doing now to help meet this new demand?
A number of them are launching their e-commerce platforms and grocery delivery services.
National chains like Whole Foods, Fresh Direct, and Instacart are struggling to keep up with demand for online orders, up 150% compared to last year. Amazon, which owns Whole Foods and other grocery delivery services, said help is on the way, writing in a statement, "We're adding more delivery windows throughout the day and hiring over 100,000 positions across the U.S., and will continue to expand quickly to reach more customers." People are also turning to options like curbside pickup, offered by retailers like Target and Walmart. Kroger, the nation's largest grocery chain, says it's responding to increased demand by waiving its $4.95 fee for curbside pickup. But many on social media are saying these options don't work, with one person writing, "They no longer can offer curbside service because slots are full, delivery full too, and they are recommending not going into the store either. So how exactly are we supposed to get groceries now?" One idea, consider turning to services that can do the shopping and make deliveries. But it comes at a price. I tried Postmates.
Okay, so my Postmates order just arrived. There it is. I ordered 47 items, but only 20 of them arrived, and it took a lot longer than the original promised delivery time.
On top of the grocery tab, I paid $28 in fees. Postmates told us they would investigate our order, but added they are not typically used for large grocery deliveries. There's also TaskRabbit.
Hey, are you Sean? Yes, I am.
Our producer's delivery guy arrived in just 2 hours with all his groceries, but this time the fees totaled $34, what we agreed to up front.
Yeah, we're
Also, check some of your local restaurants. Some are filling the gap and offering groceries and even meal kits.
All right, we're going to stick on this topic here for a little bit, talking about grocery stores. That's because Jim Mendoza is working on a special story for tonight. He interviewed Janai Wall, that's the CEO of Foodland, and she described to him what they're doing here locally to make it safe for everyone.
So we're doing a lot of things, and our team is all the time talking about what do we need to do, how do we need to adapt to adjust our processes and how we're serving our customers in our store to ensure everybody is safe. So we've started for a while now. We've been doing wellness checks of our employees. We've put in plexiglass shields. We have promoted social distancing and told our store directors that they have the ability to limit the number of people in the store so that they make sure it's not too crowded. We're giving our employees masks that they can wear. And then we're also looking at new services that we can offer by expanding our online ordering, pickup, and delivery.
Now to an update on Daniel Day Kim. The actor says he received a clean bill of health thanks to this guy, Dr. Phil Suh. The actor and producer credited the doctor on Instagram for helping him get through COVID-19. Kim is set to make his debut on NBC's medical drama New Amsterdam tonight. His character, the head trauma surgeon, will take on a deadly flu strain in the hospital, which is very timely. You can watch the show right here on KHNL at 8 o'clock. And the 43rd annual Nahoku Hano Hano Awards have been postponed due to the ongoing pandemic. The awards for excellence in music from Hawaii will now take place on Thursday, September 10th at the Hawaii Convention Center. It was originally scheduled for May. The awards show is among a slew of major events postponed or canceled because of the virus.
Yeah, I'm glad to see they postponed it and it's not just an all-together cancellation, because I really love seeing that every year on K5. Like, I sit down on that Saturday night and make a point to watch it. All right, guys.